Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindemann. Doc, what's going on, man? How are you?
We are doing really well here, Neil. And you?
Very good. Today's topic, cervical ripening and cytotech use. What does cervical ripening mean?
It means getting the cervix and the top part of the vagina ready for delivery. So it means thinning and softening of the cervix. It means softening of the top part of the vagina. It means having the baby's head come down against the cervix and sometimes into the top of the vagina. So it means, and also there is the likelihood that the joints in the pelvis will soften and stretch when it comes time to push the baby through.
What does induction mean?
Well, there's a difference in, cervical ripening means getting ready for induction, but once the cervix is ripened and ready, that's when you start your induction. And in this country and most parts of the world, induction is done most often with IV Pitocin.
What agents can be used for cervical ripening?
Well, we have prostaglandins, which are made especially for that purpose. They have a little string on them, so you can take them, you can remove them if you find that you're getting contractions that are too strong and causing fetal distress. There's also a balloon catheter. You can use a Foley with a bulb. You put that up through the cervix. The bulb goes into the bottom part of the uterus between the baby's head and the cervix. And of course, there's laminaria, and that's laminaria are dried up seaweed sticks. So you put them into the cervix, not above the cervix, but into the cervical canal, and they absorb the fluid from the vagina and they swell and cause the cervix to dilate and soften.
Has cytotech received a bad reputation?
Yes, it has. And I think there's a couple reasons for that, Neil. One is that people get worried about an off-label use, but off-label just means that this is something that we use for a different purpose than what the drug company has talked about. But it's certainly safe. These are very safe. The main problem, I think, though, with the misinformation about cytotech is dosing. In my experience, because I've watched my patients carefully, I realized that cytotech in a dose of 25 micrograms once is the dose. If you look at some of these studies, they'll go anywhere between 50 and 200 micrograms every 2 hours. And that's way overdose. That would be like drinking 10 gallons of water a day. It's just extremely unreasonable. But that's the way the dosing has been done. So we have the false or the misinformation about the dangers of cytotech.
Has cytotech received a bad reputation? That's what we're trying to go in for. The first question was, all right, I said that twice. Okay. All right. So that's it. So the best place to go is ruraldocallen.com and safepregnancy.com, but also allenlindemann.com, right? MD.com.
It's Lindemann MD.
LindemannMD.com. Okay. Appreciate it. You're listening. That was the Rural Doc Allen podcast, guys. Take care.